Good morning, everyone. Thank you all for joining our Facebook Live event for Coffee and Conversations, a Black Maternal Health Forum. I know it's early, but we have some important information to share with you, so I hope you all take it in. My name is Kirsten Fowley-Thomas. I'm the Managing Director for Equal Ground Education and Equal Ground Action Fund. We are a political nonprofit building Black power here in the state of Florida through empowerment, training, and education. So last cycle, as we were talking to voters about the 2020 election, we surveyed those voters and asked them what issues were important to them, their families, and their communities. And so, with that, we were able to use those issues, take those issues that they mentioned, and really center our work around empowering and educating around those issues, including the work and the priorities that we took on for the Florida legislative session. And so the bills and the priorities and the legislation that we focus on center around those issues, which include health and the success of Black women. And so it's Black Maternal Health Week, and we have a lot to discuss on this issue. So, for those who don't know, Black Maternal Health Week was established to raise awareness around the alarming rate at which Black mothers face life threatening experiences while pregnant. At a time where mothers are dying in delivery rooms and suffer from negligence by healthcare providers that are supposed to help them and whom they're supposed to trust. We really can no longer afford to let these issues go unaddressed. And so, Representative Camilla Brown and Representative Angie Nixon have both filed and co sponsored legislation to really address these issues. So today we'll hear from them, our legislative leaders, and then we'll also hear from a panel of experts on facts and the status of Black maternal health and resources that are available to moms. So let's go ahead and jump right into it. Um, I'm going to introduce the panel and then I'm going to bring them all up. And so first we'll have Representative Camilla Brown. She'll be joining us shortly, but she is a Florida State Representative representing District 45 right here in Orange County, where I reside. She has also filed legislation, and actually is the reason we have gathered here. Is it was her vision to bring together a panel of experts to bring this important issue to the forefront of our community. So we thank her for that. Then we have Representative Angie Nixon, who is also a state representative who represents the Jacksonville area in District 10. She has also filed legislation, and we are excited to hear about how her bills will help mothers. Then we will hear from Miss Lo Berry, who is the president and CEO of Reach Up. And Reach Up is here to advocate and mobilize resources to help communities achieve equality in healthcare and positive health for families. Then we'll hear from Miss Jenny Joseph, who is the owner of Common Sense Childbirth and has dedicated her life to helping women and families have better birthing experiences. And last but certainly not least, we have Liz Buford, who is a licensed therapist and owner and CEO of We Matter Health Solutions, whose mission is to provide excellent health interventions to all seeking healing. So I am so excited to have these lovely panelists with us today. And as I mentioned, Representative Brown will be joining us shortly. All right. So before we get started, I will say that Ooh, can everyone mute unless you're talking, please? Perfect. Um, Thank you all. Before we get started, I will say that I do have specific questions for specific panelists, but you all are experts in your field. So please feel free to jump in and add any additional content. I want this to be of the best flowing conversation that we can have. And so let's jump right on into it. The first question is actually for everyone. Taking into consideration the civic and social environments that impact women's maternal health, can you talk to me about how being a Black woman in America can impact our maternal health? And I'll actually start with Representative Nixon on this one.
Good morning, everyone. Thanks for having me. And so, to your question, my name is State Representative Angie Nixon. Currently in Tallahassee right now. Currently have my little girl with me, my 7-month-old as well. And so, what does Black maternal health mean to me? I think what it means, especially living in this country, it's trying to ensure that my mental health is good, ensuring that I am trying to lead as much of a stress-free life as possible, or managing my stress levels, so that I can be my best self for my children, and for myself while I was pregnant, right? So like. Unfortunately, while I was pregnant, I was running for office, so I was high stress, right? I also contracted COVID. Should have eaten a lot better. Should have managed my stress levels better, because right now I'm unfortunately suffering from consequences of that, and I have like high blood pressure still to this day. Never had an issue with blood pressure, not even with my first daughter 13 years ago. And so just having, Black maternal health, good Black maternal health, just is taking care of yourself so you can be set up for your baby. Sorry. Sorry.
No worries. Thank you so much. And thank you for sharing that personal story. Um, Miss Lowe, we're going to head to you. What does Black maternal health mean to you? Oh, I think you're muted.
Good morning. And first, I want to say thank you all for this platform. Black maternal mortality awareness just makes sense. And for me, Black maternal health means assuring that during every stage, Black women and their babies reach their full potential for health and well-being. However, simply surviving pregnancy and childbirth is not the marker of success. And we have to make sure that we focus on well women's health across the lifespan, from womb to tomb. And that should be our aim.
Awesome. Thank you so much for sharing. Miss Jenny, what does Black maternal health mean to you?
Good morning, yes, and thank you very much for this opportunity to talk and share. I agree exactly with what Rep. Nixon has mentioned, what Ms. Lowe has mentioned. For me, what I think we have to acknowledge, especially as we are talking about addressing and redressing these disparities that are showing up for Black women and Black families, Black communities, and people of color, is that we have a responsibility on our side. I'm a healthcare provider, but I'm talking about the healthcare systems. I'm talking about the public health systems. And I talk a lot about what I call maternotoxic areas or maternotoxic impacts, pop-up maternotoxicity. For example, someone like Serena Williams, who was not even protected with her celebrity, her revenue. She had money, she had good insurance, I'm sure, and yet she had to end up fighting for her own survival inside of a hospital, which is supposedly the safest place to be. So we have to recognize that this isn't about individual women and mothers taking on the responsibility alone of trying to fix it, make themselves better, do better, survive. Like that's a responsibility on the mother and the family. No, we need the structural supports, because this is historical. This is deeply embedded into the medical system and the way we practice, and this has to stop.
Absolutely, absolutely. And I actually was, we're going to talk about the incident with Serena later. So thank you for bringing that up. And lastly, Liz, what does Black maternal health mean to you?
Yes, good morning, everyone. Thank you for having me. So I agree with what everyone said so far, and the point that I want to focus on is education and advocacy. I'm coming from the mental health perspective, but I'm also a mom of two. And going through that process of having a baby, we did a lot of research, and we found that, if you don't speak up for yourself and know what your body is telling you, a lot of things can be overlooked in the medical setting because of the disparities and the way that the system in the medical profession is built and was built, kind of overlooks us. And so I think that knowing what your options are, who your resources are, what your body is telling you, and being very sure and advocating for yourself when you're talking to your medical team is super important, because if you don't push, sometimes they just say, oh, it's, that's part of pregnancy, or, that's not really a problem. And they just kind of leave you going. And we read these horror stories all the time of young mothers dying for very preventable reasons. So I think from my perspective, it's education, advocating for yourself and for your family. And then when your baby is born, advocating for them as well.
Awesome. Thank you so much for sharing. So Representative Nixon, I know you have sponsored and co-sponsored legislation that will help Black mothers, incarcerated mothers. Can you just talk a little bit about your legislation, and if passed, what will these bills do? How will they impact the community?
So definitely. So I co-sponsored and Representative Brown sponsored HB 183, which is it establishes the Office of Minority Health and Health Equity. What that bill would do is it will require the Office of Minority Health and Health Equity to develop and promote statewide implementation of certain policies and programs and practices. It will require a representative from each county department to serve as a minority health liaison. It would also require the Department of Health to maintain specified information on its website, requiring the office to serve as a liaison and to assist certain federal offices. And why that's so important, I think, to the young woman that spoke right before me, in regards to just advocating for yourself and your health. Some people don't necessarily know how to do that, right? Like I can speak from two perspectives. I can speak from when I had my first daughter, when I was pregnant with my first daughter, I was still in college, my last semester, on Medicaid, and had a doctor, a white male doctor, who just was very passive and nonchalant. And I felt that physically and mentally, right? Didn't have the best labor and delivery. And it's because I didn't know how to advocate for myself and didn't know necessarily what I deserved. Fast forward 13 years later, with my daughter, I went out specifically searching for a practice that was ran and operated by a Black woman, Dr. Chandra Adams, in Jacksonville, Florida. And it was a complete 180 from what I went through, 13 years prior. And it's really important for us to establish this office, because again, like, we have to get that information out to the population that needs it. Though oftentimes they're low income, and then just oftentimes they're Black and brown, and much like another woman on the call stated earlier in regards to Serena Williams, oftentimes we're seen as strong and able to handle pain. And so any issues that we may say we have, some doctors kind of like just push that to the side. And this is speaking from experience. And so I think that this office is designed to help alleviate some of those concerns, right? And so another piece of legislation that I actually primarily co-sponsored was actually HB, it is called HB 1115. And what that bill does, it is an expansion of the Tammy Jackson Act, which passed last year, which that particular piece of legislation called for dignity with incarcerated women. So pregnant women, if they were in labor, they had in prison, they would have to immediately be sent to a healthcare facility. They couldn't be shackled while they were pregnant and things like that. So I have an expansion where we were seeking to defer a woman's sentence up to 12 weeks postpartum, right? So after her sentence will be completely deferred. It's like she's on probation. And after 12 weeks, then she would go back and enact her sentence. And what does that do? That allows a mom to be able to bond with her child, that allows a mom to be able to figure out where her child can be placed while she carries out her prison sentence, that allows a mom to establish good nursing habits. And we know how hard that is, right? And so it's a great thing to do, to not allow a child to be born in a cage, right? And it's a great thing to do for the health, the physical as well as the mental health of the mother and the child. And so those are the type of legislation that we're seeking to get pushed through this legislative session.
Awesome. Thank you so much, Representative Nixon. Where are those bills at in the process? And I want to make sure that we can support it if possible.
Right. So HB 183 in regards to the Office of Minority Health, I believe it has one more stop, and it's actually coming up in committee, I believe today. And the other bills, it's moving. My bill particularly is moving in the Senate. However, the Florida House is a very interesting place, and it has unfortunately not gotten agendaed. The conversation that I've had with the chair has been very interesting, to say the least. But I do look forward to refiling this bill on next year, because it's something that should definitely be addressed.
Absolutely. Thank you so much. Okay, so moving along, Miss Berry. Studies have shown that pregnancy can be risky for both the mothers and the infant. Are there any preventative resources available for Black women as it relates to risky pregnancies, like being able to prevent risky pregnancies?
Yeah, there's, it goes back to the education and advocacy, and what Jennifer mentioned, we have to address systemic and structural practices that impede good birth and health outcomes. But the very first thing I think that we have to consider is, in order for us to change these poor health trajectories, we have to be able to leverage and manage resources and sort of level the playing field and equip the moms with the knowledge of the birth process prior to giving birth, and understand the factors that put them at greater risk. And so the education and advocacy in particular for Black women is addressing structural and racism and its impact on birth outcomes. And so that women can be very clear about the reasons why Black women tend to have preterm births and baby being born too early, too soon, which has a whole lot to do with stress. And has a lot to do with, for some, the friendly and quality access of care during the pregnancy. And then unfortunately have to still deal with the postpartum piece and what happens after, delivery. And so the education and advocacy piece is critical. Training and teaching women and their families, and really the community at large, about women's health, period. Understanding that preconception, postpartum, interconception are all very important periods. And as I alluded to earlier, understanding that your life trajectory is about more than the pregnancy period, that it is about your life from beginning to end. And so for us, what we found to really sort of change the mindset of the mothers that we work with and the families that we work with, we advocate for specific resources, and the resources that we ask people to really hone in on are those resources that really look at social determinants of health and health equity as core components of its mission. And so we also think it's very, very important to have meaningful male inclusion and to bring the dad in the mix for optimal health for the entire families. And then equipping the women with their voice. So it's very clear to them that they're ultimately in control, of their health destiny. And also, what we feel is really important for women to understand is that their voice matters. And organizations such as Black Mamas Matter and similar actional movements in the country, it does give voice to women. Access to health care is important, but organizing those services in ways that recognize and respond to the needs is even more so. Then there's local and national in all communities, mostly, organizations that promote good birth outcomes and health outcomes, and some of which are, Mocha Moms, the Divine Nine for the Greek organizations have strategies and activities around health. Nationally, you have National Healthy Start Association, National Black Mamas Alliance, and National Birth Equity. And the last is the advocacy partnerships, really educating and training families and women about partnering and advocating for their health and connecting with organizations that respect that. And statewide and across the country, as we all know, there is an ongoing challenge of obtaining health care for the most under-resourced and marginalized women of color before and between pregnancy and afterwards. So I don't know if she's on the call yet, but I really, really want to personally thank Representative Brown for sponsoring House Bill 1381 to expand Medicaid coverage from 60 days to a year. And thanks also to the Speaker, the House Speaker, and leadership for prioritizing maternal health in Florida and extending the postpartum Medicaid coverage and also increasing the state Healthy Start funding. Huge resource.
Awesome. Thank you so much. It sounds as though there are some preventative measures that can be taken. We just need to make sure our communities are educated and informed on these on these resources. So thank you. Speaking of that, Representative Brown has just joined us, so I would love to give her an opportunity to talk about her legislation that she has filed, and if passed, if you could talk about what this bill would do for our communities.
Okay, well, there actually are several. House Bill 1381 sort of looks to improve maternal health outcomes. It is actually, it went into its last stop and now is headed to the floor. But what it would do is provide a telehealth component, more of a substantive telehealth appointment for many of our moms. And sort of this bill sort of comes from just my own experience, over the pandemic, being pregnant and, thankfully knowing what to do to advocate for myself. But there are not many telehealth services for pregnant women. So not only women in areas that are, middle class, but many of our low income, just working with, or just the work that Jenny Joseph does at her particular facility. She had many moms that were located right in our community that was unable to receive health care. And so this bill was important to make sure we have, access to quality care. And also, if there are many high risk, because many Black women do have underlying conditions or will have an onset of underlying conditions once being pregnant, this particular bill would provide them with toolkits to make sure that they are being that their needs are being properly addressed and that they're being properly given actual care for not only them but their baby. House Bill 645 deals more so with the extension of benefits for many of our moms that are currently on Medicaid. Right now, we give only 60 days for Medicaid benefits. And that is after you deliver. What studies have shown us, in order to improve many of these outcomes that we're looking to have relating to Black maternal health, it's important that we extend many of these, extend these benefits in order to help with the various complications that happen so many times with us, with Black women. That bill currently is within the House budget, and we will go into conference soon, budget conference, and it is my hope, I'm very optimistic that the Senate will agree with this need, and we look forward to it passing out of both House and Senate and on to the governor.
That's awesome. I know how Representative Nixon, we were just talking about how difficult sometimes it could be. So I'm glad to hear we have some movement there. Thank you so much. Speaking of Jenny Joseph, since you just brought her up, Ms. Jenny, would you please talk to us? You know, we hear a lot about midwives, or we hear the term a doula. What exactly does a midwife or a doula do, and why are they so important to our birthing experience?
Yes, it is a lot of confusion, but hopefully I can help clear it up. A midwife takes care of women through pregnancy, delivery, postpartum, and in between of babies by providing medical care and support as long as that person remains low risk. Midwives are like OBGYNs, but only handle the low risk cases. But the key for a midwife is that the midwife centers the mother baby as a pair, and they always work from that angle of mother baby having that. They have shared decision making, they have access to all the questions they have full on support. Midwife means with woman. A doula, on the other hand, provides similar types of support, but certainly more education and advocacy around having mother baby family be able to get their needs met from an emotional support angle, from a perhaps physical needs such as, massage or certain techniques and positions during the labor and delivery, and for postpartum, certainly they are there to just be that person. So think of a doula as a non-medical provider. Essentially, doulas have been with us for millennia. Women have always helped women in birth. Women have always supported women in postpartum. We never had this as an issue. We didn't need these types of providers back in the day because they were always your family. They were always there. You could depend. Your mom was going to be with you when you were going through your childbearing experience. So midwives provide medical support in terms of, hands-on checking your blood pressure, measuring your belly, delivering your baby, helping you with breastfeeding, helping you postpartum. Doulas do all of the spectrum of care, but never medical care. They are non-medical providers.
That made so much sense to me. So thank you so much for breaking that down. I actually have a follow-up. I was reading a story on Instagram, and it was about a woman who seemingly had carried a healthy pregnancy, and she went to give birth. She had a doula. And I believe the baby was experiencing some sort of jaundice or something afterwards. And the doula was like, oh, no, don't take him to the hospital. Don't take him to the hospital. Like, just wait, just give it some time, just relax your stress. They ended up going to the hospital the next day, and the baby experienced some brain difficulties. And now, as a result of the doula's suggestion, the baby is now has brain issues that he would not have had, like it was preventative. He would not have had they were instructed to go to the hospital sooner. That obviously is a very extreme case. It's very troubling and scary story. But when choosing a midwife or a doula, what suggestions or advice would you give mothers? And what questions should they be asking, and things should they be looking for to select the right one?
Yes, it's very important. Just like any provider, you have a sense in your spirit. You have a check in your spirit. You have like an overarching, I'm not feeling comfortable. You have to use those feelings, mother wit, intuition. We know in our heart when we're like, I'm comfortable, I'm safe. When you don't feel that, you don't feel that. So whatever provider you're choosing, you need to be able to stand strong on your convictions. Again, like I said, doulas are non-medical providers. Your story illustrates a doula giving medical advice. That's not a doula's role. Likewise with a midwife. A midwife is a provider for low-risk women. When a woman becomes high risk, don't work with a midwife because you need an OBGYN. So what we're missing in this country, and I think in our state, is an ability to collaborate. And there's a lot of barriers, which I hope this legislation will help us remove these types of barriers, because we must work as interdisciplinary teams. We must work together. What we have to be very careful of is not re-traumatizing or putting in more barriers than are already there. We have so much to overcome. And one of the quickest routes to that is to be able to work, all the healthcare professionals working together, the community providers, the community organizations, the women-led, the Black women-led organizations and agencies have knowledge and understand their communities. There's congruence with their communities. But we have to work together with hospital systems, with physicians, with high-risk doctors. If we don't have a relationship and a collaborative stance, a collegial stance, we continue, I believe, to be the genesis for these poor outcomes. We are so caught up in our silos, but we're also caught up in our deeply embedded racism, our classism, our sexism, and gender discrimination that impacts women's health and their babies' health. So whichever provider you're looking at and choosing, trust your gut. If you find that you're not comfortable, see if you can move on. Keep going till you get to the person who is listening to you, who cares enough about you, and will protect you through this process.
Definitely. And you know, it also goes with the saying, a closed mouth doesn't get fed. And it's important that we not only, if we don't have access to care, there are many of our friends. You know, I was very grateful to create a sisterhood of new moms when I got pregnant, to be able to kind of bounce things back on and see who are those, you know, who are those good healthcare providers. You know, I sought out to find out, you know, who were the Black doctors within my community. I was not being seen by a Black OBGYN, but it was important that I make sure I go to interview those that would, you know, fortunately take my healthcare. But it was friends that I've had that have been moms prior to me that was able to provide me those resources. Healthy Start is the Healthy Start Coalition has always been a good partner within our communities and with the Department of Health. And it's important. And, you know, she mentioned there is an increase in the budget, but it's important that we do collaborate with many of these organizations. I believe there was a bill that Representative Nixon talked about that does exactly that. That the language in that bill asks the Florida Department of Health to partner and work and collaborate with our community-based organizations, those boots on the ground, to make sure resources that are available to women do get out into our communities.
Yes, can I just add one thing about the doulas, because those who know me know how I love the discipline of the doulas. And, you know, that story is heart-wrenching. But one of the things I like to really remind folk is that the doulas that you work and you choose a doula like you do any other discipline. And as Jenny's talked about, that gut feeling, that intuition and that wisdom together, make decisions about who is your professional. And with the doulas, make sure they're certified. There's all types of disciplines, and there's offshoots now of various disciplines. We've had doulas in our community with our organization for 22 years. Been really fortunate and blessed not to have any deaths of women that have a doula, any deaths of the babies that had a doula. So we've been very blessed and fortunate, but there are women now in different factions of doulas that are not certified. And so just be really careful about the doulas being equipped and being certified is one way to address that.
And we've also seen Black women, when just data shows that Black women who do utilize doulas do have better maternal outcomes.
Absolutely.
So the data shows that, and it's something I know within legislatures across the country, we're looking to have, our state recognize doulas as a profession, but also, have folks to be able to get those reimbursed based through their Medicaid services.
Yes, you're absolutely right.
Awesome. Yeah, that would be awesome. Thank you so much. I do want to shift gears a little bit and talk more about mental health. So we constantly hear about postpartum, and sometimes it can be a catchphrase in our community. But Liz, I would love for you to just talk about what does postpartum mean and how does it impact Black women?
Sure. So before I get into that, I really loved what this previous conversation on building that maternal community and knowing who the good providers are in your community. I found this is not related to these providers that I'm going to speak on, but since people are watching, and if you're looking for a wonderful Black OB/GYN, my personal OB is named Dr. LaCrystal Warren, and she works out of Contemporary Women's Care in Winter Park. And I found her through a system of ladies who needed a Black OB, and she's been wonderful. I had 2 high-risk pregnancies back to back, one during the pandemic, and it was a great experience. The other one is Dr. Jennifer Simpkins, and she's in Seminole County at True Health. And she's awesome. I worked personally with her when I worked at True Health in the behavioral health department. So if anyone is looking for a Black OB, like I said, they didn't ask me to pub them, but we're sharing resources. So go ahead and look them up. But back to the mental health aspect of it all. So postpartum depression is definitely becoming a more, I don't want to say trendy, but a more common phrase that we hear. But it might be misunderstood of what it actually means. So postpartum depression is when you feel a specific type of depression, either during your pregnancy or after, and or both. And the biggest indicator of that is when you are lacking a connection with your baby. So when you hear about motherhood, you hear, oh, it's just going to be a natural connection. You're going to love your baby. It's going to be the best thing ever. And sometimes that isn't the case for any mother, not just Black mothers. And there's other symptoms of postpartum depression, just feeling unmotivated. I've heard a lot of people say, well, I just felt like I had to keep the baby alive, and that's all I could give. So that is a big thing in our community, partially because women of color are predisposed to certain things that can increase your risk for developing postpartum. One of those things is a history of mental health issues, and depression specifically. So if you've had that before in your life, you are at a higher risk of developing postpartum depression. Health factors like high blood pressure, high stress, things like that can increase your risk. And something that we don't talk a lot about, I think, or enough about, is your feelings on getting pregnant in the first place. Some of us weren't ready. Some of us, it was a surprise. My pandemic baby was a surprise. And so, we don't want to admit that, because it sounds like, oh, how could you feel bad about getting pregnant? But sometimes it happens. Sometimes it's not in your plan, and you have mixed feelings about that pregnancy, and that can be create a higher risk for you developing postpartum depression. So, hey, to my pandemic moms, I think two of you share my story there, but that is a thing. And I also want to mention something that is not talked about but is very prevalent, which is postpartum anxiety. And that's when you're feeling high levels of anxiety, meaning like ruminating thoughts of your baby being harmed, or that you're not being a good mother, or just very irrational thoughts of bad things happening to your child, or to yourself, or to your family. And that can be misunderstood as just being stressed, and you have, you're a new mom, and these things. But when it impedes your life, now we're talking about postpartum anxiety, and sometimes you can have both of those things going on. So in a nutshell, those are the two things that we should be thinking about, is postpartum depression and postpartum anxiety.
Thank you. We actually haven't really heard the term postpartum anxiety as much as depression, so I appreciate you breaking that down. As a follow-up, is postpartum depression and anxiety, is it preventable? And if so, or if not, what resources are actually available for women to tackle these issues?
Sure. So I think it's more about being educated to lower your risk of developing postpartum depression or anxiety. Like I mentioned, there are things that put us at higher risk for developing them just naturally. And so if you're aware of that, you can talk with your healthcare providers, the full team of them, and do things to prepare. One of the biggest things that you can do is have a great support system in place during your pregnancy and after, because you want to lower your stress level as much as possible. Being able to say, hey, I need to take a nap. Can you take the baby? I need to get out of the house. Can you take the baby? Things like that sound small, but they're so important and can make or break your experience with right after you have your baby. Also, eating right. I think our diet is something that gets lost in the mix, because when you're pregnant, you tend to, want to just eat whatever your body's telling you to eat. But paying attention to that, we have a higher disposition to develop diabetes during pregnancy and high blood pressure. And those things create a higher risk for developing postpartum depression and anxiety. So I think just knowing the risk factors and knowing your specific risk factors and talking to your teams about them. I think it was Miss Lowe who mentioned a lot of Black women-led support networks who can, if you know what to ask or who to ask or where to go, they can offer some direction. I think finding a therapist. I think everyone needs a therapist. I'm biased, but I truly believe everyone should have a therapist on call. Right. And that can be a great place to just ask questions and say, hey, this doesn't feel right. What should I hear this term? What does it mean? And that person should be able to point you in the right direction. So again, I think it's all about knowing your body and advocating for yourself and knowing the right questions to ask. And I think that the bills that we're discussing today will be a big part of that, because Representative Nixon mentioned that sometimes you just don't know how to advocate for yourself. And these resources will be paramount to getting the word out there for these women.
Awesome. Thank you so much for sharing that information. I did have a question next. This was for all the panelists. I believe it's covered, but I want to give an opportunity for anyone to share some additional thoughts if you have some. But it was it was about looking at what happened with Serena Williams. So typically, as mentioned before, we look at the lack of access to health care to one socioeconomic status, but we know, in Serena's case, that wasn't the case. Money wasn't the problem there. And so, and as it relates to advocacy, does anyone have any additional thoughts that they would like to share on what are your thoughts around that specific issue and how can women advocate for themselves? I know we talked about it, but I just want to open the floor if anyone has any additional thoughts on that.
I'd love to jump in here.
Okay.
This is one of my, I guess my areas where I get a little worried because I hear we talk about this a lot. Obviously, this is a big concern, but I worry about we put it back on the mother, back on the family, back on everybody else to come in with let's fix our own problem. It's not that we shouldn't work hard, and we do need education and advocacy, but I think it's time for us to tell the truth. And the truth is that it's the systems that need to do work as well. We can all work together, but we have to be working contemporaneously. So it's the system that had Serena in the mess that she was in. So if we talk about the safety of birth, we talk about the quality of care, then the system is part of that, and a large part of that. So it's not to blame them or shame them or put anybody on the spot. It's just to address the fact that just like we took on social determinants of health are the overarching issues that affect us in our health, so medical systems that are not safe, because Serena wasn't safe until she won the fight. Charles Johnson's wife, Kira Johnson, didn't make it. He advocated for his wife for an entire 10 hours, and she still died. She was in the hospital. We have numerous stories of maternal death, maternal morbidity, where families or even the woman herself are advocating for themselves and still succumb. So this problem is also part of our systemic ways of looking at how we handle the institutionalized biases that are lethal. So I don't want to just put it on the patients or the mothers and the families. We need to look at the healthcare providers. We need to look at the healthcare systems. We need to look at the risk managers. We have to acknowledge that this is a business, and people running businesses don't always have the same goals and aims as those that aren't.
Absolutely.
I think we should just call it what it is, right? It's based on systemic racism. Like, as you all were talking, when you were asking the question, my mind just immediately went back to like my ancestors being in the fields, having to have a baby, and then immediately having to go back out and pick cotton or cut down the sugar cane and things like that. And so she was right when she said it is a systemic issue, and it's important for policies like HB 183 that Rep. Brown sponsored, that I helped, co-sponsor, because I just knew it was the right thing to do, because we need advocates that are a part of the system, right? Like you said, we can't just blame the moms. And like I said previously, 13 years ago, I didn't know how to advocate for myself. And there are people right now that look like me and you all, and they don't know how to advocate for themselves. And we have to really call it out and let folks know, and actually bring impacted individuals into the face of these people that can pass this legislation, and let them know how negatively impacted we are by this.
Yeah, I just like to say too, like Jenny, this is a topic in the forefront of my mind all the time. Just calling a spade in this arena, and being truthful about what the disparities look like and why they exist, and looking at it from a structural change perspective. And in the Hillsborough County, I am so proud of the task force that we most recently created, the Hillsborough County Healthy Star Coalition and Reach Up Inc. And we started last summer with thinking about it and talking about creating a coalition wherein we did one thing and one thing only: effectively address Black maternal and infant mortality disparities in our community. and then bring in the population at large and the community at large as task force members, and train and talk about and have groups around their stories. Those who have experienced loss, with babies, and those have family members who have experienced maternal loss, and then conjointly and in a concerted effort work together to create our own structures, our own systems, how we're going to combat and do that. So it is definitely about taking the matter in our own hands.
Absolutely.
Collective. And so it's important for us in a massive way across the country, across the state of Florida, to create these truthful task force that's really looking at and aiming to get at the structural issues, and who is not ashamed and not embarrassed, and who is equipped to talk about how racism gets into our physiology and how it impacts our overall health and our life period.
And it's so unfortunate that you find so many of these same stories of, again, just the biases and racism that, has killed so many of our moms around this country. And it is just something that has inspired me to, look more into this particular issue from a legislative standpoint to make sure I am able to do what I can. We have looked at, the data, which is not much, but we've looked at the data. We've also, worked with many of the companies that is providing the insurance, these insurance providers, making sure they do what they're supposed to do as well. And not only that, many of our healthcare providers. We have, PAMR, who looks at, is a task force up under the Department of Health, who really looks at, this particular issue, infant mortality and maternal mortality. And they've broken the data down, have come up with why these women are dying, have created toolkits, but we don't have many of our healthcare providers using the training that they're suggesting to receive. And so, years past, we looked at, trying to require many of our hospitals to really take some form of this and make sure they train their people. It is a work in progress. I am grateful for the federal legislation that has come down, and I am very hopeful that, the new administration will look further into this issue. I mean, there was a start up under the previous, but I have a great feeling that this new administration will make it a priority to really force folks to collect this data, but also force them to receive the training they need so that we as a community can have better outcomes, and these moms can really go home to do their job, which is to be a mother to their children, something they so want to do.
Thank you, Representative Brown. That actually brings me to my next point. I just, knowing that you and Representative Nixon have filed legislation specifically around this issue, what can community members do to help and get involved in this? And you guys know me personally, I'm a big advocate for people being involved in legislative session, but I would love for you to share what community members can do. And is there any national federal legislation that we should be paying attention to? And we can start with Brown and then Representative Nixon.
Well, yeah, definitely. There is the Momnibus Act, which is been filed this year again by several of our legislation. Many of you have a lot of co-sponsors on that bill, but it is a comprehensive package of various things that look at, again, changing the outcomes in maternal health. It provides funding to many of our local communities to do the work, to do the education on the piece. It recognizes doulas, and it also creates a more comprehensive telehealth package for many of our moms, and really looks to ensure that quality access to quality care is provided. It also provides incentives for many of our states to jump on the bandwagon of extending Medicaid benefits to our moms for 12 months. And so I am hopeful that this year that will be received. It is the Biden's administration. They just recognized Black Maternal Health Week, I believe, a couple days ago or yesterday. And so they have committed themselves early on to do this good work for our moms. We have like I say, several community-based organizations. And it's important that we, within our community, provide education and provide support to many of our women. Through the Office of Minority Health, there is the Close the Gap grant program. And some of the pieces of legislation that I have looks to prioritize those that are working within that Black maternal health space or the minority maternal health space, provide priority to their grant applications to receive money to do a lot of the work that is needed, on the ground. And so share the information, share the resources. I know Ms. Joseph does some great work within Orlando, throughout the Orlando community. It's based out of Winter Garden, but she has several facilities throughout the area. And Miss Berry, she has been doing a phenomenal job. I've been requesting for her to not retire so soon, to make sure, all of us are equipped with the information and the wealth of knowledge that she has, so that we are able to help many of our moms.
And I'd just like to add that the Momnibus bill is being led by Congresswoman Alma Adams. She's out of North Carolina. And that reintroduction is also have the support of Senator Cory Booker. So we just, keep praying, lifting up our fingers crossed. And as you're saying, advocate on that behalf, keep up with it, right, to our Senate, our representatives. And, you can always also keep in contact with the office of the lead person, and they will instruct us, directly where it is and what it is that we can do as a community. And this is a community as a whole across the country.
Representative Nixon, did you have anything else to add to that?
Yeah, really quickly, what I would say is elect more Black mamas. I mean, simply put, when you elect people, they usually legislate from which they came. I legislate as a Black mom, and so I try to file bills and craft bills that impact Black mothers in a positive manner. And so I think it's really important for us to elect Black moms.
Yes, absolutely.
Very good point.
Can I jump in real quick and just say, this is Black Maternal Health Week, and it's that week because it was so designated by the Black Mamas Matter Alliance. And this is the 4th year already that this has been the week, April 11th through 17th. But if you notice, it is on fire. Like, so many activities across this nation, so much work going on across our state. And just think about that in 4 years, the impact of a group like Black Mamas Matter in terms of influence in awareness, knowledge, and empowerment around the fact that Black mamas do matter. So I just wanted to throw that out there too. Thanks.
No, thank you so much. All right, so much has been shared. So in closing, I would love for everyone to have an opportunity to share your final thoughts. And if there are any final resource recommendations that you would like to lift up. Let's start with Liz.
My final thoughts are, I think these conversations are so important. I learned a lot today, and hopefully the people listening, got some good information and resources, and just gets your mind thinking about these issues. Sometimes when you aren't directly affected by it, it doesn't matter to you as much. But I think this information is important, not just for Black moms, but their support systems, their husbands, their brothers, their uncles, the men in their lives, the extended family, our older folk that usually help us through the process that did not have access to the resources that are here now. So please share the things that you've learned today in other spaces. And I'm really happy to see that the conversations, like Miss Jenny just mentioned, are happening a lot more. Again, I'm from the mental health side of life, so I always advocate I push people to get therapy in our community. It is, there's still a stigma around it. We tend to say, just pray about it, or, that's, fight the battle, you'll be okay. And, or we don't talk about it. There's lots of family secrets in our communities. As for a different forum, but that all of those things, create generational trauma and cycles that we have a responsibility to break as Black moms and Black people in general. So if you are looking for a therapist and would like that therapist to be a Black therapist, there's several different ways you can find them. A quick Google search will lead you in the right direction as well. But if anybody needs help looking for that specific person, please feel free to reach out to me. I am a therapist, so I could see you, or I can help you find someone that will fit your needs, and just get that conversation going in your household, because it's so important. And not just for the Black maternal conversation, but just in Black communities in general. So that's my mental health soapbox for today.
Awesome. Thank you so much. Ms. Berry? I think you're on mute.
So this week reminds me, quite frankly, of the fragility of women's health and the necessity of advocating and pushing a collective voice for women. My mom always said, and we call her Big Mommy, always said to us, in trying times, it's not over till it's over. And on behalf of thousands of under-resourced and marginalized families, we appeal to the Florida Senate and hope that it is clearly conveyed to our senators that the significant proposed budget cut to Help You Start would not just dampen the disparities work that we're all talking about, but it's also will reverse some strides, some serious strides and gains that we've had as a state community in a twinkling of an eye. And so and thousands are asking that the Senate please reconsider and help us to protect our 30-year-old unique community-based safety net. It is so important. Thank you.
Awesome. Thank you. Miss Jenny?
Yes, I'm going to go back to it's time to tell the truth. Mm-hmm. And with that, I really feel like we need to remember that all of us need access, we need connections, we need knowledge, we need empowerment, and that not just for the mother or the mother-baby family, but for the providers. We must support our providers to make these shifts. They are also hurting, they're traumatized as well. They know that they are doing things that are in systems that aren't helpful. There's a lot of moral injury around trying to provide health care, particularly obstetric care, in our current system. So we must look at how we support them as they work through their needs to transition into more humane, safe, compassionate care. And we also need to support the families. And so we move these blame the mother tropes out of the picture. They're not helpful. But what we do know is that if we tell the truth and acknowledge the pain that all of us are suffering, we will prevail and we'll come out the other end. So absolutely, my last thoughts are Black mamas matter, Black families matter, Black communities matter, and we must push forward. And thank you all so much for this opportunity to speak today.
Absolutely. Thank you. Representative Nixon, and then we'll end with Representative Brown.
Thank you for the opportunity to speak today. I just want to echo everything everyone stated, but I also want to just really implore the community as a whole. I know we shouldn't just necessarily put this on ourselves, but just in regards to having been a previously mom that suffered through a lot of issues, maternal health issues, if you see folks are struggling, like, help them out. If you know resources that are available to them, let them know. And let them know that it's okay to give themselves grace, right? Because we're Black women. Oftentimes we suffer from that superwoman syndrome, and that could be very debilitating to our mental health. And so in order for us to just live life to the fullest and have a really good quality of life, like, just step up when you see a sister down and like help her out and just really encourage her and let her know it's okay to cry, it's okay to make mistakes and mess up, and just be supportive of her. That's what I would say.
And I would just close by saying, to our moms and soon to be moms, share your story. We have improved so much as a community, and have been able to provide the resources that's needed in our communities just by people sharing their stories. We have seen the support and just the overwhelming education that many of us have received just by folks sharing their story. And so feel free, moms, and like I say, soon to be moms, my office is a resource. We would love to plug you in as to whether or not you want to be an ally or a supporter of these efforts, or if you are looking for resources for you and your family to help you through those situations and your care. We, again, have seen better outcomes when the care starts on the front end versus the back end. And so it is my hope that everyone will take away from this, education is the key, and making sure we share our stories and work as a collective to continue to improve the health of our women, but also with doing that, we improve and create a successful outcome for our babies as well.
Awesome. Thank you so much, everyone, for sharing. This has been such a powerful conversation, such a needed conversation for our communities. I know personally myself, part of my delay in starting a family is my fear of Black maternal health and the horror stories sometimes that I hear. So just these experts being able to share their experiences and their resources really is starting to help calm my nerves a little bit and get me prepared for when that time comes. Just wanted to reiterate that Equal Ground Education, we are here as a community resource. We are Black-led, Black-focused, and making sure that our communities are engaged and empowered. So we will be sure to make sure that all of the resources that were shared, we are putting together a document that will be shared this weekend. So please feel free to, if you have any, feel free to reach out to our organization and we can add that to the list. I also want to say that this was also streamed on our YouTube channel, so we'll share that link so anyone who did not want to get up at 7:30 in the morning to participate in the panel discussion can find that there for them to watch at their time. Again, thank you so much for panelists for taking some time to chat with us, especially to our legislators who are in Tallahassee fighting the good fight. We are praying for you and rooting you on. But again, until we have our next forum, we thank you and hope you all have a great rest of your day.